Good evening, everyone. I'm Dr. Hita Patel from IAP Digital Media team. I'll be host for the today's webinar, which is on research proposal writing with the resource person, Dr. Nehal Shah ma'am, being organized by IAPWC Kheda team and IAP Research Committee. The Indian Association of Physiotherapists is the oldest and largest association representing physiotherapists in India since 1955. The IAP digital media team consists of a group of physios who handle Zoom platform, webinar live streaming, and IP profile on social media platforms, Facebook, Instagram, Twitter, LinkedIn, and YouTube. Follow the IAP profile on this social media to receive the notification of our events such as webinar, workshops, CMEs, conferences, health camps, blood donation drive, and to know about recent updates on physiotherapy. Subscribe to IAP YouTube channel for notifications of our live webinars. In a playlist section of this channel, webinars are segregated into various folders. The topics like orthopedics, neurology, sports and fitness, pediatric, community rehabilitation, cardiopulmonary rehabilitation, women's health, research, cancer, and many more. For the easy access, you can share this link. The social media link will be shared in the chat shortly. For the today, the moderator of this session is Dr. Grishma Shah, who is and sub-coordinator of Kheda District Coordinator, and she's an assistant professor at Ashok and Rita Patel Institute of Physiotherapy, Charuset. Ma'am, over to you.
Thank you, Kheda ma'am, for the introduction. Good evening, everyone. I warmly welcome you all to today's session of virtual research series organized by IAP Research Committee and IAPWC Kheda. So today marks the day 5 of the series. So here we know that research does not begin with data collection or analysis. It begins with a well-structured research proposal. A research proposal acts as a roadmap that clearly outlines what we intend to study, why it is important, and how we plan to conduct the study. As Louis Foster once said, chance favors the prepared mind. And in world of research, a well-prepared proposal reflects a prepared mind. It helps researchers organize their idea, communicate their vision clearly, and ensure that the study is methodologically sound and ethically justified. So moving on to our session for today, it is my privilege and honor to introduce our esteemed speaker, Dr. Nehal Shah ma'am. Dr. Nehal ma'am is currently Dr. Nehal ma'am is currently serving as a principal of SBB College of Physiotherapy, Ahmedabad, and she brings with her over 28 years of rich academic and clinical experience in physiotherapy. She is a renowned expert in orthopedic physiotherapy and electrophysiology and has made significant contribution to advancing physiotherapy education, clinical practice, and research. At a global level, she serves as a vice chair of Asia West Pacific region of World Physiotherapy, contributing to development and promotion of physiotherapy practice internationally. She also plays a key leadership role within India as the National Head of Research Committee of IAP and Joint Secretary for the West Zone. Dr. Shah has delivered more than 100 lectures, globally presented research at World Physiotherapy Congress, and has been part of international collaborations such as Australia-Indian Trauma Systems Collaboration aimed at reducing injury burden. She has also been invited as one of the panelist speakers by the WHO on fall prevention in the elderly, highlighting her contribution to global health initiative. With her vast experience in research, clinical sciences, and international leadership, we are truly honored to have her with us today. Dr. Nehal ma'am, we welcome you. It is our privilege to have you on the floor. The floor is all yours, ma'am.
Thank you so much. Thank you, IAP Women's Cell Kheda, for inviting me for this talk. And I hope I'll be able to, give a broad outline, gross outline of how to actually write a proposal. So without wasting much time, I guess let me start. All right. Yeah. Wait. So is my screen visible?
Yes, ma'am.
And am I audible? Yeah.
Yeah.
Right. So, the topic for today is writing a research proposal. For past week, I guess we all have got a good brief outline of research, how to conduct a research, and what all things we should be keeping in mind, including the research ethics. So, after all this basic background with us, today we are going to understand how we should write a research proposal. So, before that, say there is a place nearby your house and you go daily to that place using this route. One fine day, your friend tells you that I have found out another way which is more beautiful, more scenic than from the way you are going. So, that becomes a search. That is a search by your friend. Now, if you want to see which road is better, the road that you are taking or the road that your friend is taking, that becomes a research, because there you will keep certain parameters in mind, right? How much is the distance? How much is the traffic? How is the pollution there? Is it green? So all that things you keep in mind, and then you try to find out exactly which way is better, and that becomes your research. And suddenly, one day, while exploring all these, you find a place immediately next to this place that you have been visiting, which is not visited by anybody. Then that becomes your innovation, that yes, there is one more place which is more beautiful, which is better, and which nobody has seen till date. So, this is basic what is search, what is research, and what is innovation. And now, with this, so, research is a growing industry, and there are more than 7.1 million researchers in the world. There has been fierce competition between almost 25,000 journals across the world. So, you understand how big this industry is. There is a need for research, and there is a need for research in physiotherapy for generating evidences. We are, if you know, Indian population or Indian scenario for physiotherapy as a whole lacks evidence-based practice. We have been highlighting a lot, we have been talking a lot on evidence-based practice, but we are hardly practicing it because Indian evidences are missing, good quality evidences are missing. And that's why there is a need to generate the evidences. There is a need to guide clinical practice, identify best practices, addressing continual changes. See, what we studied way back 30 years back is not what we are practicing today. It has come because our field is continuously evolving leaps and bounds. And that change also has to be addressed properly with proper evidences. And that's where research is necessary. This ultimately helps in improving patient outcome. And then at the end, it also helps in research allocation and policy development. So if you look at the entire research process, there are steps. First is you identify the research question. I want to do the research, but in what? Is there anything in mind? Yeah. So the first step towards research is identify the research question, where you identify the topic or the problem. For example, say we talk about, say a very simple example that I'm telling you, IFT for knee pain. So first of all, you have to identify that I want to do something on the knee pain and I want to study on the effect of IFT. So that is your research topic, or it becomes your research problem. Is IFT effective for knee pain? For that, then you start looking across for the evidences to see how many evidences are supporting, how many are not supporting. Then you identify the variables. Okay, it is not only IFT for knee pain. We have to take other criteria also into mind, the outcome measures, the whatever. And then in the end, you formulate your hypothesis. So now you have identified your research question, then you design your study. So you design a research protocol, you choose a sample. I want to do for knee pain. Now, if you look at knee pain, the causes of knee pain are different at different stages of life, at different ages. So you have to identify the correct sample or the correct population. I want to look at it only for osteoarthritis knee, then your sample will go towards middle and elderly people. You want to look at it at the patellofemoral pain syndromes, then your population goes towards the younger population. So you identify the population or the sample. You design the protocol. Okay, fine, I want to give IFT, but in that, what I want to give in IFT, that what dosage, what time, that all entire protocol. After that, whether I want to give any exercises, will I have a control group? If not control group, will I have another group giving some other modality? So that is a part of designing your research study. And then you start doing data collection. So now, okay, one group I want to give IFT, another group I am putting it as a control group, because I want to see whether IFT is better than what I am using normally, right? So you should have a control group, and then how much dose of IFT I will give, how many days. Are there any set of exercises that I want to give? Will I give these same exercises in the control group? So what I'm going to do becomes a part of the design and the method. Once you have collected the data, then you start analyzing this data, and that is you go with the statistical analysis and then start interpreting that analysis. And last but most important is communication, where you should report whatever are your findings. See, you do a study and then you don't do anything with it, just present it in some conference, or just you do it only because it is mandatory for you to do research, is not right. The world should know, because after all, it is your hard earned work. You have worked hard for it and you have got some inference out of it. May it be positive, may it be negative, whether your treatment was better or whether the control treatment was better, that is also an information, and that the world should know. And for that, you should report. Report means you should publish it, and publish it at a good index journal. These, whenever you are performing a research, these are your honest friends. Where, why, how. The more you ask the question, the better you get the reply, and the better you can refine your research design. Scientific writing is usually dissertation or a thesis, which majority of you, because you are PG students, majority of you are doing, or you publish it in a journal, but it is in general a document that describes the process, progress, and the result of scientific research. Why you should write? If I ask you, people sitting out in the audience, majority of you will say because it is required for the fulfillment of a degree. Ma'am, we are doing MPT and it is mandatory for us to do a research as a part of our curriculum, and that is why. Otherwise, I don't like research so much. That's what majority of you are going to say, because you feel research is boring, research is cumbersome. But believe me, research is rewarding also, because it is compulsory. You want to do it, or you want to share the outcome on. People who are really passionate about research will want to expand the professional body of language. Now, coming to writing a research proposal, what is the purpose of a proposal? So there are different reasons why we should write a research proposal. It reflects the appropriateness of the research areas. The better you write, the better you will understand the appropriateness of what you want to do. You will have to, once you are deciding your research, you have to understand that you have to prepare a proposal, because you have to present it in front of your ethics committee. A research is considered to be good and a standard one only and only if you have an approval from the ethics committee. And for that, initially you have to present your research in the ethics committee or the institutional review board. say you want to get your research funded, you want money, because everything, whatever research you perform comes with, you have to spend some money towards your outcomes, towards, there are so many things. So if you want to apply for any kind of grants or fundings, whether within your institute, which is called intramural funding, or outside your institute to some other bodies, like if you are writing, if you are applying for IAP research funding, you are applying for any government body like DST, etc., which is known as extramural funding. But for that also, you need to write a research proposal and you need to write it very well. It enhances communication with your other co-investigators or even your guide. When you write it and show it to your guide will also understand your perspective, what you actually want to do. And it guides to ensure following of the rules of conduct, because once you write a proposal, you cannot stray away from that proposal. So it will give you the correct rules of conduct. So you have to first identify the issue, like what problem does your research address? Then you design your research. So how will the research achieve its objective? And how will it benefit, or what your research is going to contribute ahead? So these are the key component of a research proposal. The first is the title of the study. Then you have to write down the introduction, your research question, your aims and objectives. You have to write down review of literature. You have to write down methodology and ethical considerations, expected results. In what timeline are you going to finish this research? If you are applying for funding, then you have to also prepare a rough budget and write it down. And then the references, because you must have reviewed many articles before finalizing this research design. Now, what is a research question? It identifies specific problem to be explored. It sets boundaries for the scope of research. It helps to clarify the objectives and make your study relevant and targeted. And it provides framework for designing the methodology and analyzing the result. So a good research question should be feasible and researchable at your place. See, many times my students come and say, this is what is given in my mother article. This is what is given in one mother article. This is that. See, if you are going to just copy and paste what is done in a mother article, then it is not your research and it is not a good research, right? You read multiple good literature and then you make your own research question which is feasible for you. You know your clinical setting, you know your academic setting very well, and so you have to have a research question which is feasible at your place. The outcomes are available at your place, right? You want to do something on the gait of a patient, and then if you write your outcome as a gait analyzer, you don't have that equipment at your place. What? So you have to, then in that case, you have to look at some other outcomes, right, which can address this. So you frame your research question depending on the feasibility. And a research question should be significant. It should be able to fill the gaps in the existing body. As I said, you cannot just copy paste your mother article and say that since this is done, so this is done in Orissa, I want to do in Gujarat. No, it is not done that way. Or this is done in some other country, now I want to see its effect in India. This is not a correct way of framing a research question, right? And it should have a theoretical and the evidence basis as well. So characteristic of a good research question, it should be finer. Remember these acronyms, finer and smart. Finer means feasible, intriguing, novel, ethical, and relevant. And smart means it should be specific, measurable, appropriate, relevant, and time bound. Most important, it should be time bound. Okay. So now steps to formulate a research question. So this is how I do with my students also. First, identify a broad topic. So in that, say choose an area of interest or clinical relevance. Say some student comes and tells me, I want to do something on back pain. So that is a broad thing, that this fellow wants to do something on back pain and wants to do pain management in back pain. So now that is a broad topic which is identified. After that, you do a preliminary review. How to do a literature review is already taught to you. We may not go into the detail, but you go and conduct a preliminary review. And that literature review should be done to understand existing research and identify the gaps. I want to do something, but whether this is already proven, whether there are researches on this, if there are researches, something is missing in that research, that you should be understanding after doing a literature review. Then identify unresolved questions or area of controversy. Then narrow down the focus. So my broad area was low back pain patients and pain management. Now I am still refining my focus, and I'm going towards more specific population. I want to see I want to study something on, say, young individuals. Nowadays, young individuals are having a lot of back pain. So now my population age is coming towards young adults. So then I'm cutting down, I'm coming to the age group of 18 to 45. I am also looking at intervention. Now, pain management is very huge. From that, now after everything, I want to see whether IFT is working or not, or whether electrotherapy is working or not. So I'm narrowing down my interventions. And then after my literature review, I will look at the outcomes also. What all outcomes I want to know, I want to study on. So whether I want to go with VAS or NPRS. I want to do a functional scale also. So then what functional scale should I be using? Do I want to add any other outcome, something assessing the posture or not? So now I'm narrowing down my topic and define the variables. As you know, there are dependent and independent variables, and that you have to define. So independent variables are the factors manipulated or controlled by the researcher, and that is your treatment strategy, or that is what you want to study. For example, types of exercise. I want to see the effect of strength training exercises. So that is my independent variable because I can control it. I can adjust the dosimetry of the exercises as per my need. Then comes dependent variable, which is your outcome or the effect being measured. So when you use this VAS, when you use any functional scale, they are your independent variable. There are other variables like control variables, that are the factors that kept constant to avoid influencing the result. Age of the sample participant, duration of treatment session. I want to give 10 days of treatment, age group, young adults, whatever. Extraneous variables, they are uncontrolled factors that may affect your dependent variable. Personality of a participant or his motivation level. You may select somebody who is as such type 1 personality. So no matter what you give, pain is not going to be fine. And those are, if you have taken that, at the end of it, your result may be affected, because it's not that the pain is not good because your treatment was wrong. It may be because the patient is a different personality, but again, it is not in your control. And confounding variables are the variables that correlate both with independent variable and dependent variable, like pre-existing fitness level, or if there is some pre-existing problem, again, they may skew your results. So now framing of research question can be done as per PICO format in quantitative study and as per spider format in qualitative studies. So population, intervention, comparator, and outcome. So that is your PICO format for making a research question. And for qualitative study, sample, phenomenon of interest, design, evaluation, and research type. So that is a spider format. So here are some examples. For a quantitative research question, does a 6-week strength training program improve pain and function in patients with chronic neck pain? So this is a research question. And then you will design your objectives and your methodology based on this question. Is joint mobilization more effective than capsular stretching? So it is group A versus group B. The first is group A versus control. For a qualitative research question, how do patients with chronic low back pain perceive electrotherapy in their recovery? What are the factors responsible for pain relief in a patient with shoulder pain in a general hospital setup? So there you do all the descriptive analysis, you interview the patient and do the descriptive analysis, and that becomes a part of qualitative research question. And then there are mixed method research question where you are trying to mix two methods and do a study. So what is the proportion of patient with type 2 diabetes mellitus having vestibular disorder? And what is the patient reported outcome? So we are doing two things. One is finding the prevalence also, and then you are trying to go with patient reported outcomes also. So this is how you should frame your research question. And this, after this research question, so you have come to, for example, low back pain in young adults, and then coming to electrotherapy, say you want to do on IFT. So does 10 days of IFT improve pain and function in young adults with low back pain? That will become your research question. And now you will start doing your literature review based on this research question. So, why you should read? Literature review is to be done to provide a scientific context for the research, validation for importance, and it is feasible. It lets you know the feasibility, and you will get confidence in yourself. To avoid duplication, whether the same kind of study was done before, identify the potential problems, and increase the, because you are the one else. So the focus of literature review should be on the theoretical framework of the study, because your literature review will help you frame your methodology, will help you decide the dosimetry, and will help you decide the outcome measures, right? So it gives a theoretical framework of study. It lets you decide the patient population, underlying pathology, method and equipments, statistical technique that you should be using, and all relevant studies, even if negative. So say you want to see the effect of IFT on low back pain, you should read all the articles that say it is effective. At the same time, you should read all the articles that say it is not effective, because then that will help you refine your research design. So the steps for performing the literature reviews: decide the scope and objective of the study, search for relevant literature, organize and manage sources, do a critical appraisal of the study and identify research gap, synthesize and write the literature. These are all the different databases where you should search for good literature. And understand, I think this must have been done, so I'm just going fast. What are keywords and what are Boolean operators? So keywords represent main concept of research. Boolean operators will refine your search by combining or excluding specific term and or not. So if you say IFT and NEOA, then it will give all the results of IFT and all the results of NEOA, right? Likewise. So you should understand how to use your keywords and Boolean operators. And how should you appraise the research article? First, look at the relevance. So does the study address the research question or objective? Then go ahead and study. Is the population intervention or outcome similar to the area of focus? Then check out with the quality of methodology. Was the study design appropriate for your research question? So whether it was an RCT, a cohort study, a qualitative study, are the sample size and selection methods adequate? What does that particular result tell you? So are the findings consistent or aligned with your study? Are the results statistically or clinically significant? Are there any biases or limitation? And how does this article contribute to the field? Where does the study advance the knowledge or practice in the field? Or does it fill the research gap or build on previous work? So you should be reading a research article depending on all these things. So the best example, now I want to write it in my proposal. How would I write it? So say there was the example topic, effectiveness of IFT in managing neck pain. So how will you start writing? XYZ et al. In 2019 conducted a randomized control trial to investigate the effectiveness of IFT in reducing pain among patients with neck pain. Now, relevance with our what we are planning to do. This study is highly relevant to the current investigation as it explores the same population and intervention. However, it focuses solely on pain reduction, whereas the present study also examines functional mobility. So this is how where your study is different from something which is already proven. The study employed a robust RCT design with 120 participants randomized into IFT and placebo group. While the sample size was adequate, the lack of blinding among the participants may have introduced performance bias. So this is now appraising it, whether the method was correct, what all were the flaws. Additionally, the authors did not clearly define intensity setting for IFT, making it challenging to replicate the intervention. So why you want to do IFT if IFT is already done? Because these are the limitations that you found in the study, and now you want to address this limitation. And this is how you should write your review of literature. Right. Now, what does the other studies also do? So XYZ study also looked at the significant pain relief with IFT. However, unlike this, their study incorporated functional assessments, offering a more comprehensive evaluation of intervention impact. So now there was some other study also, and this something was better in that other study, which now I want to incorporate into my study. This study contributes valuable evidence supporting the use of IFT for short-term pain relief. However, its limitation, including unclear intervention parameters and lack of functional outcome measures, highlight the need for further research to address these gaps. And now I want to address this gap. There are certain words which look good when you write your review of literature, and they are, while the study demonstrates this, it is limited by this. This study aligns with the previous findings, but its scope is narrower due to this reason. The methodology is robust, but the lack of dash reduces its applicability. The study provides valuable insights, but further research is needed to address this gap. So this is how you should be writing your review of literature. May it be a research proposal, may it be in your thesis or your dissertation. Now, how to frame your research title? It is a descriptive sentence stating the exact topic of research. The first impression is your last impression, and so your research title should convey what the study is all about. It should be informative, like topic, design, results, but at the same time, it should be concise, accurate, and specific. So say this is example of some study. If you look at the title, this is a very big title, and yet it is still not telling the type of the design, whether it was prospective or retrospective. The number of children or the number of sample should not be mentioned in the title. So now how do you frame your research title? PICO is already done. I'm aware about it. So PICOT, you can use a PICO format. Or there are other styles. So say you want to publish it somewhere. So if you're writing your dissertation, it has to be in the Picot format. But there are other style depending on the journals also have their guidelines on framing the title, which you should follow. So your journal may want your article in the Picot format, or a journal may want an article in a question mark, or you can just mention the conclusion and which can become your title. And remember, most important thing, never use any abbreviations in your research title. Example of inappropriate research titles, like a study on the effect of stress. Arey Baba, you are doing a study. Why do you want to write a study? I have seen many a study to evaluate this. So to evaluate this becomes your aim. It is not a title. So a study to do dash 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 is not the correct way of writing a title. Investigating problems related to research in physiotherapy. Again, variables are not clear and this does not lead you to the research question. So all these titles given here, can video games improve cognitive abilities? Now there are so many parameters. You have to specify on which parameters you want to see. So these are the examples of inappropriate research titles. So after that, what is the role of as per ICJME, what is the role of the author? You, as an author, have to make a concept and design of your research, data acquisition, analysis, and interpretation. You are the one who is going to draft the article or review it critically for intellectual content. You are the one who is going to prepare the final approval version, and you should be accountable for the work. And any people along with you doing all this become co-author along with you. Now, how do you write the introduction or the background of your research proposal? You always should begin with writing relevant definition. So if you are doing a research on something wherein you already have a proven definition, you write that. If the proven definitions are not there, you can make a operational definition, but you have to write that in your introduction. Then you highlight the summary of facts, problems, or controversies found in literature, or try to identify the gap. Say you are doing on knee pain, you should have a definition of knee pain. You should have etiology of knee pain. I mean, what is the prevalence of knee pain in India or in whichever region you want to do it, for example. And then what are the, in general, our treatment options available? But then what is the problem with the available treatment problems? What are the controversies? And your introduction should lead you to the need of your study, right? So it should then take you towards the specific need of your study, because there are controversies in using IFT, but there are good results clinically. You want to see whether IFT is effective or not. And then you also have to mention in your introduction, why is the problem being studied? Why you want to see the effect of IFT in knee pain? What is the reason for that? Hmm? How you are going to answer it? So just by giving IFT, you also have to mention about the usual treatment options available, or conventionally or standardized exercise protocols or standardized treatment options available for that same particular condition. So that constitutes your introduction, and you should be writing about only these points in your introduction. Then after that, you will be framing your aims and objectives, which helps you to focus the study, avoids unnecessary collection of data or unnecessary data. It organizes your study into clear-cut parts, and it facilitates development of correct method, right? And you should be using these words: to compare, to determine, to verify, to establish, to evaluate, to describe. Please do not use the words like to see, to find. No, you should be using appropriate or correct kind of words to enhance your scientific writing. So your aim is overarching the goal of research. It provides broad statement of what to accomplish. Your aim can be primary or secondary. For example, to evaluate the effectiveness of resisted exercises on pain and function in patients with ONE, osteoarthritis knee. So this is your aim. Now to achieve this aim, you have to formulate objectives which are actionable and measurable steps that will help you to achieve these aims, like to evaluate the effectiveness of resisted exercises on pain and function with ONE. That is your primary objective. But for that also, you have to see what conventionally or what standardized treatment protocols are giving. So you have to see the effectiveness also of the standardized exercise protocol. And then you have to compare the program that you have designed and the program that is traditionally available, which one is better. So you see the individual effect of standard protocol, you see the individual effect of your design protocol, and then you compare the two. And once you get the answer, that is an answer to achieving your aim, whether your set of designed exercises are better or not. Hypothesis generation. Hypothesis is a testable statement that predicts the relationship between variables and guides the direction of a research study. So your hypothesis should be testable, realistic, with well-defined variables, and it should test relation between dependent variable and independent variable. So your intervention A and B. So standard exercise protocol, and whatever you have designed, whatever becomes your independent variable and your outcome becomes the dependent variable, and it is formed only, you have to form hypothesis only in experimental or correlation studies. So null hypothesis is, say there is no difference between the effect of A and B on this particular outcome. Whether I give IFT or whether I give hot pack, there is no difference in the effect on pain relief. So that is your null hypothesis. Now you have to frame your alternative hypothesis. There is a difference in the effect of A and B on pain. So this says either IFT is better or hot pack is better. So, and that becomes two-tailed. Whereas if you say that IFT is better than hot pack, it becomes your one-tailed hypothesis. Now, writing the methodology. It is a creative writing skill. Your methodology is the most important part and it is the heart of your study. It should be clear and detailed. It judges the soundness of your work. If the flaws are there in the method, research has no value and cannot be rectified later. The better your design, the stronger your design, better outcomes you will get. And the methodology should be written such that it has minimum limitation. Many times what I see is, you select a small sample size, say you do a research on say only 10 samples, and then in the end you write down sample size too small. You knew it, the sample size is small. Why do you then do it in a smaller sample size? Why do you not want to do it with a bigger sample size? Right? So you have to make 100% of the study, and then if there are flaws by chance, then you can put it in the limitation. But don't decide the limitations first while deciding your methodology. So now how I should write the methodology. The first thing I will write is the type of a study. It was a randomized controlled trial which will be performed. It will be, because I'm writing a proposal. So a randomized controlled trial will be conducted to compare effectiveness of IFT and TENS in patients with knee pain. Define the target population, and also your inclusion and exclusion criteria. So adult age 18 to 45 years with knee pain will be included in the study. Those with recent surgeries will be excluded. You can frame your own inclusion and exclusion criteria to decide your exact population in whom you want to conduct the study, and you should write it accordingly. Sample size and sampling method. You should apply the formula. There are formulas to do a sample size estimation. Do that and calculate the sample size and do it on that sample size to avoid the limitation of smaller sample size. And then what was the sampling method, whether you used simple random sampling, whether you use convenient sampling, whether you use stratified sampling, that you have to mention. And then the intervention procedure you have to mention in great detail. With group A was given IFT with this dose for 10 minutes. Patient was instructed this. Intensity was kept at this or as per tolerance of the patient. Patient were instructed to report us if this was there, this was there. Group B, TENS was given with these parameters, whatever parameters you decide. Additionally, both the groups received so and so kind of exercises, which were similar. How many repetitions, how many sets, everything has to be described in great detail when you are writing your intervention. How will you collect the data? So whether you have to have your assessment performance and your outcome measure for data collection. It can be surveys, questionnaires, some tests, some outcomes like VAS, muscle strength, using dynamometer, etc. And identify your outcomes like WOMAC, PADI, MODI, VAS, NPRS, whatever is there for your study. Now you have to write your data analysis plan also, which means data analysis plan means I will be comparing this with this. I will be comparing this. I will be doing a descriptive analysis on finding the prevalence by doing this. That plan and what software you are going to use, that also you should be there in your proposal. And then decide the timeline. My study will get over in 6 months, 12 months. And then in this 12 months, the first 2 months I will do this. Coming 2 months, I will do this, like that, which is known as a Gantt chart. So you prepare a Gantt chart also for the study timeline, and you have to write it down in your proposal, right? So if you look at this, can you see they are mentioning about ethics approval, sample size was estimated, this was the inclusion criteria, this was the exclusion criteria. Everything has to be written in detail. Now, some ethical consideration. Ethical consideration, most important, informed consent, patient participant informed consent, and participate in information sheet. I mean, you have to inform the participant what all you are going to do in detail, and then take the consent in written, take the signature. Confidentiality and privacy. You have to assure that the identity of the patient will not be revealed. You have to know that you have to do no harm to the patient. This participation is voluntary, and if the patient leaves your study in between, that will not harm the future treatment for the patient. Ethics committee approval, most important. Transparency, honesty, equity, fairness. Do ethical research. Don't manipulate the data. Everything you should keep in mind, because our aim is patient safety, and determination of patient safety is one of the most primary objective and important responsibility of we as investigator. And that comes to the notion, what are adverse events? Any untoward medical occurrence associated with the use of your drug, in this case our exercise or our treatment protocol in humans, whether or not it is related. Say you want to do some set of exercises in your research for geriatric population, and then while doing the exercises, patient has a fall. You did not want that fall to happen, but because of any reason, your patient has a fall. That becomes an adverse event because it is something which is harming the patient, right? That needs to be documented. Adverse events need to be documented. Why do we collect adverse event data? Because we want to determine the safety profile of our treatment protocols. And we want to evaluate the risk and benefit. Say there is some new treatment that has come up. We want to find out the effectiveness of the treatment. But what if this treatment is harming more? It may give a temporary pain relief, but it is harming my patient. Then what? Right. So we have to evaluate this risk also. And that is why we have to collect adverse event data. And along with our protocol, along with our research proposal, adverse event form should be prepared by us, which has to document what is the severity of the adverse event that has happened. Patient had a fall, but whether that fall gave mild injury or a severe injury, whether that injury was life threatening, whether patient got head injury while fall, it becomes our responsibility if the patient has got that injury, whether this fall was related to our intervention or not, whether we had not started the treatment, patient was just walking to us for the treatment, but patient fell down in front of us, we were not giving any intervention at that time, so that fall was not related to our exercise, but patient did have a fall while he was a part of our study. So whether this fall was related or not related, what action did you take, whether you changed the dose, whether you referred the patient, whether you did the first aid of the patient, what did you do? What was the outcome? So problem was solved, patient worsened, patient died, or patient went away, and then you don't know what happened to the patient. Whether right, and you have to document all these things, and after that you should also be aware what are severe adverse event, because even severe adverse event which you are anticipating has to be documented. So severe adverse event are the event that results in death, life threatening, or places the participant at immediate risk of death, requires prolonged hospitalization, or cause some significant disability which affects the ADL, or results in any defects or any other condition which investigators judge to represent significant hazards. So you have to document that with this protocol, these are the severe adverse event that I am assuming, right? And your essays should be as less as possible with whatever research protocol that you design. Many a times my students say that, ma'am, we are doing it on normal, healthy individuals. There are no severe adverse events. But don't you know cardiac arrest is so common nowadays? You do certain exercises, and what if the patient, even if a young, healthy individual or a young, healthy student gets a massive cardiac event while performing the exercises given by you? He was a sample, and that's a severe adverse event, right? So you don't have to be overconfident about severe adverse event. And remember, all severe adverse events are adverse events, but not all adverse events are severe adverse events. But you have to be very, very careful and keep this ethical considerations into mind, and report all adverse event to your guide or to the ethics committee. Now, where will this be described in our research proposal? So it will be described in the investigator's brochure, where you are preparing your brochure to be presented to the ethics committee. It should be described in the package insert, or when you are telling the patient about your study, you have to tell that these can be adverse events. You have to be honest to your patients, right? And it should be described in the protocol and informed consent. So this is I was lucky enough to be a part of one Australia India trauma system collaboration, which was a multicentric research happening in India, and it was a treaty between Government of India and Government of Australia, and it was rehabilitation prescription allowing injury following lower limb. There were many researches conducted under this, but if you look at this was the research proposal, can you see? They have very nicely described the probable adverse events and probable serious adverse events, because it should be there. You as an investigator should be aware that my treatment can give this much of harm to the patients. Now, I saw in the group somebody was asking what is plagiarism. And it is very important when you are writing your proposal should be plagiarism free, right? So the World Association of Medical Editors defines plagiarism as the use of others' published and unpublished ideas or words. Somebody has done some study and is in the process of publishing it, and before that you pick up the entire study and publish it in your name without crediting that somebody. That is known as plagiarism. So, studies have said that over 90% of medical students in their second year plagiarize to some extent when asked to write essays on given topic, and 1 in 20 medical residency applications, they also contain plagiarism. So, very widespread, very much in row, but we as researchers should make sure that we don't do plagiarism. There are softwares that detect similarity index. So they are repositories. There are databases. So the software puts your research and tries to see whether the same thing is there in another researches. And it says this much of similarity is there in your article, which is the percentage of overlap between text submitted to plagiarism detection and that in the original source material. And they should not be considered the percentage of paper that is. This software scans the database of crawled content, identifies the text components, and then compares it to the component or content or other work. So it just checks with the other databases that are there, other researches that are there, and see whether you have just copied and pasted. So while you are writing your proposal, your dissertation or whatever, make sure you don't copy paste the same sentence of a reference article. You have to make your own sentence. Otherwise, it will come under similarity index and it will come under plagiarism. Right? The allowed percentage is 10 to 25%, which means your article up to 25% similar to some other article is acceptable, beyond which it is not acceptable. This similarity is compared with internet sources, publications, submitted paper even. And in computing similarity index, following is excluded, the quoted text. So if you are writing a definition, you should write into inverted comma and italic. Then it will not be counted as plagiarism because definitions you are supposed to copy paste. Bibliographies don't come under similarity index, and small similarities up to 10 to 14 words, which is less than 10%, the software does not count into consideration. So how you should avoid it? Setting of software must be non-repository. Many of us, they have a habit of, trying to go for online free plagiarism check of our article. I warn you, please don't do it. Because if you do it, it remains, your article remains, whatever you have done remains in its repository or in its database. Next time, if you try to publish it, the journals also go for plagiarism check and your article will be found plagiarized, not because someone else has published it, but because your own thing has come into picture. So please do, I'm warning you, don't use online available plagiar check softwares, or if you are using a paid version also, setting of software must be on non-repository mode. Use your own language. Keep the sentences short. Use the synonyms for commonly used repeated words. Present the output or summary of your data analysis in your language. Please don't copy paste the SPSS table that also comes under plagiarism. And report the results in your own table. Different software give different percent of similarity depending upon their databases. So if your similarity is less than 50%, your work is plagiarism free. If it is below 24%, your paper is still acceptable. If it is between 25% to 49%, the paper needs to be revised and resubmitted. If it is between 50% and 74%, the paper requires a lot of revision because it indicates that there is a possible plagiarism. And if it is more than 75%, The paper is unacceptable and it should be rewritten. Good journals do this and they do this religiously. You copy and paste Google images, but that also comes as cyber plagiarism, image and video plagiarism. You should only use those images which are Creative Common license. There are different licensing given to the images. So you have to search for Creative Common license image and use only those image. Many of my students say that, madam, we are acknowledging this, though this is present, we are acknowledging it, but that acknowledgement in the reference for that image is not the correct way. That also comes under image plagiarism. So only use Creative Common license images for your uh, whatever purpose you are using it. Otherwise, you fall under cyber plagiarism. Copying an image from a book or the internet source without citing the original source is also not correct. Modifying an image for colors and dimensions. Okay, this image is blue in color, let me color it red and it is plagiar, then I can use it. No, that is also not correct. Transforming or altering an image using different methods and techniques is not correct. Images are a form of valid clinical data, and all norms of plagiarism apply to the images also. And mind well, in the foreign countries, the Western world is so much prone. If they sue you for using the images created by them, you will be in the court. So don't go for image or even video plagiarisms. And one most important thing that I wanted to talk was about use of AI and research. Nowadays, it has become very easy for students to ask ChatGPT and prepare the proposal. But as per the global ethical norms on AI in research, leading publishers like Elsevier, Springer Nature, and Wiley clearly state that AI cannot be listed as an author. Any AI use must be explicitly disclosed. That is known as generative AI disclosure. That you have to say that I had used AI for so and so purpose. And most important, authors are fully responsible for the content accuracy. As per the ICJME research ethics guidelines, AI tools cannot be credited as authors. They must be disclosed if used. Responsibility lies entirely with human authors. And this ICMJE has updated their recommendations in 23-24, and they have emphasized that authors must verify all AI generated content. We feel that ChatGPT gives everything correct. No, it is not correct. And you have to ensure that there is no fabrication done or it is not a biased output. Even UGC or higher education in India warns us against the use of AI. While specific AI policy is still evolving, UGC strongly enforces plagiarism regulations. It emphasizes on original student work. AI generated text without attribution may fall under plagiarism or misconduct. So please be aware. Do not use a lot of AI or just don't create your researches using AI. You feel that we are doing it, our teachers will not know, your teachers will know about it. And at the same time, if you happen to publish this, you will be caught and you will be caught badly. Don't do it. Research is not so difficult that you have to copy paste. It snatches your logical reasoning, clinical reasoning, and thought process. Don't do it. So now what is acceptable use of AI? Language editing is acceptable. If you are trying to tell AI that I have written this, now you correct my language, or improving clarity, formatting references, brainstorming ideas, this is acceptable. What is not acceptable? I am doing a study. You say ChatGPT. I want to compare NEPE, IFT versus TENS for NEPE and kindly prepare a research proposal. That is not acceptable. Generating hypothesis through ChatGPT or any AI tool, not acceptable. Fabricating the references or data, not acceptable. And submitting something which is given by your AI tool as your original work, not acceptable. You will fall prey and you can be caught badly with this. Right? In research, accountability cannot be outsourced, mind well, especially not to AI. And the last thing is reference and citation of references. We usually, because we have to reference the source, we usually do a alphanumeric referencing, and here we do it as a Vancouver style in medical science. But citations have several important purposes to uphold intellectual honesty. We have to be honest. Somebody has done hard work. What if somebody does not recognize your hard work? You will not like it. Then if you don't recognize someone else's hard work, will they like it? No. So you have to respect them by acknowledging them in your citations, right? Elements of citation is signposting, like when we write, no, according to XYZ et al, so and so, right? That is known as signposting. There is something called in-text citation, right? Or parenthetical citation. According to Lee et al., so and so, he studied this, and this is the probable mechanism. That is known as in-text citation. And there is bibliographic citation. You reference all the articles that you have read in producing this proposal towards the end of your this proposal. Different citation styles have different rule. We are mainly concerned right now with Vancouver citation, where it is numeric. So citation is given number. So you write the first reference that you quote will be your reference number 1. So you don't write any name, nothing, just superscript is as number 1. And then at the references, you write down that article. That reference style in Vancouver citation, right? And it follows rules which are established by International Committee of Medical Journal Editors and now maintained by the US National Library of Medicine. It is also known as uniform requirement for manuscripts submitted to biomedical journals. So in text, as I said, it will be given numbers, superscripting with brackets, and you then many a times the question comes that there was something which is given by one author and he has also taken it from some other source, right? So that is known as citing the secondary source. It occurs when the ideas on one author are published in another author's work. Access to the original author may not be there. Then in that case, cite the author of the work you have read and also include this source in your reference list. It is fine. The original author is automatically cited, right? And then you prepare the reference list. Your reference number 1 has to match with the reference number 1 in the reference list. In text number 1 has to match with the reference list number 1 and so on. And how do you write in Vancouver style when the article with 1 to 6 authors are there? To 6 authors, you have to write down the name of all the 6 authors in this way. And if there are more than 6 authors, you have to write 1, 2, 3, and then title, right? So this is how you should be citing your articles. And this is how there should be numbering or the superscripting of articles in Vancouver citation style. There are various reference management tools also available, which will then cite your reference as per your text and give numbers. And these are the different reference management tools. And now I am open to answer the question. Thank you so much for listening to me.
Thank you, ma'am. Thank you for such a comprehensive and enriching session. Participants, you can put down your queries in the chat box. Ma'am, one of our participants, they have asked that how to quote an image and where to write this image citation.
See, as far as images are concerned, you can take Google, the images are there in Google, the images are there in some articles also. You have to understand one thing, that research is again a market. Research is a market where people are earning out of researches. If you take an image from that particular another research, and if it was a paid article, you can understand, because that author is losing his money because you have tried to take up his image. So in that case, you don't do it, and that is why I am still telling you, use only creative common license image, or find out the source, because one image can be taken up by many people, and if you try to find out the source image, many times it really becomes very hard. It becomes very hard for you to find the original source. You have to look at the original source. Again, the citation has to be Vancouver. So figure one, what is the image of your figure 1, 2, 3, whichever you have used, and there you have to write adopted from, and then the original source from where you have taken this image.
Yes, true, ma'am. One of our other participants have asked, we are using outcome measure for assessment. Is it required to mention the validity or reliability of that particular outcome measure?
If they are available, yes, you have to mention the reliability and validity of that outcome measures.
True, ma'am. One of our other participants have asked that in our proposal writing, if they are comparing any two particular variables, so how do they address various comorbid factors associated with it? So what would be the basically role of inclusion and exclusion criteria?
Well, see, for I mean, this is the question that you yourself should answer for yourself. I want to do a research, say on osteoarthritis knee. I want to set up the age limit of the participant. I want to set up whether I will use whether I will include the surgical cases post secondary OA or not. It is all up to me. I have to be rational enough to decide that inclusion and exclusion criteria. There is no 1, 2, and 3 for deciding inclusion and exclusion criteria. You can formulate your own, but it has to match your population, it has to match your research.
True, ma'am. One another question is that is there any ethical clearance required for conducting scoping review?
No. Ideally, ethical clearance is not needed for a scoping review.
And one another participant, they want to know about secondary citation. If we are taking a point but forward by some other author inside the main article, should we cite him or her or the article which we are reading?
Okay, so I'll give you one example. Say I have done one study and I have some finding, which is there in my original paper. Tomorrow, has read my article, and Grishma is quoting my article for her study. And then 5 years down the line, someone else is reading Grishma's article where Grishma has mentioned my findings, and Grishma has also cited my article. Unfortunately, you are not able to find out my article, right? Ideally, it is my thought or my finding, but you are not able to find my article. So, what you can do is you can quote Grishma's article, right? Secondary, I am a second. If you are able to find me, you quote me also. But if you are not able to find me, Grishma has already quoted me, right? So then that is there. Try to find me. But if you are not able to find me, at least acknowledge Grishma's work, and indirectly I will be acknowledged.
Sure, ma'am. One final question is there any extra thing or any such thing that they need to write in a PhD proposal as compared to UG, PG or PhD?
Oh my goodness. See, research is an ever evolving thing. So at a UG level, we are expecting you to do a simple study so that you just understand the basics of research methodology, or you understand the basics of research, you learn how to do research. That is all is expected at an undergrad level. Now when you come to a postgrad level, you are expected a bit more, because you are expected mandatory dissertation, right?
Yes.
Do it genuinely, that will help you. And then when you go for PhD, ideally PhD is supposed to be an exploratory study, a huge scale study, and your findings out of your PhD thesis can be converted into multiple small papers, which is helpful to the society. So it is an evolving process. You study in KG 1, 2, and 3, then you study 1 to 10, then you study 11, 12, and then you study physiotherapy. Similarly, your research also evolves as you go from UG to PG to PhD to a very senior professional.
Sure, correct, ma'am. So I think this brings us to end of our session. Thank you, ma'am. Thank you for such a wonderful session. Thank you for taking out time for your schedule and enlightening us on the research proposal writing. So I hope that at the end of this session, all our participants are much clearer on understanding about how a well-structured
Just wait,
proposal.
there is some girl who is telling some Megha Shah, she has a lot of queries.
Mega Nama, I guess. Yeah. Yes, there are a lot of images at the Google. Now, how can we know about that we are doing plagiarism or not?
Right. So you would search in the Google images, say you have put one search. Beneath that icon only, there is something written tools. Just go click that tools and it will ask what images you want to see. Whether you want to see license images or whether you want to see Creative Common license images. Just click on Creative Common license images, and then whatever images will come, you can use freely.
I hope, Mega, your doubt is clear. Creative images we can use.
Creative
Yes.
Common.
Sure. Okay. Thank you, ma'am. Thank you so much for such understanding. I hope now they have better understanding on this well-structured proposal, how it is going to help them frame a better research study and ultimately publish more quality research and bring Indian context to the international level.
Please, even if my request to all the PG students or all the researchers out there, please do not fabricate researches, do not copy paste researches, do genuine work. Believe me, research is very rewarding and very satisfying. So please have your own logical thinking and try to be as genuine as possible. Thank you so much.
Thank you, ma'am. Thank you. So now on a formal note, oh, ma'am, somebody out there is asking that is there any way to contact you? So if they have any query further, they may contact you for the same.
You can reach out to me on my email ID. I
Sure,
will try and reply. Maybe not immediately, but definitely I will reply you back.
sure, ma'am. Sure, thank you. So here to conclude our virtual research series and today's webinar, I would like to call upon Dr. Krishna Vyas, ma'am. She is IAPWC sub-coordinator. Krishna, ma'am, all over to you.
Thank you, Grishma ma'am. So it is my privilege to propose a vote of thanks for enriching virtual research series organized by the IAP Research Committee and IAPWC Kheda team. So definitely the end of the series, the 6 days time, like it goes from we started and how we end. So definitely this journeys won't be possible without the speaker himself, Dr. Nehal Shah ma'am. We extend our special thanks to Dr. Nehal Shah ma'am, Head of Research Committee IAP, whose vision and initiative in starting this virtual series
under her guidance made this entire journey possible. Ma'am, thank you so much for your entire time and the suggestion which you already gave us every now and then. And because of that, only this series is very much possible without any hurdles. I would also like to express our heartful gratitude to Dr. Sanjeev Jha sir, President IAP, for his visionary guidance and continuous support. Also, sincere thanks to Dr. Ruchi Vashne ma'am, Treasurer IAP and National Head IAPWC, for her constant motivation and leadership. Because her leadership only IAPWC teams are doing so well in Gujarat. We are also deeply thankful to Dr. Pooja Kamble ma'am, West Zone Head, and Dr. Jasprit Kaur Kang ma'am, the State Coordinator Gujarat IPWC, for always guiding us, inspiring us professionally. A sincere note of gratitude to Dr. Uttara Mohan ma'am and the digital media team of IIP for the seamless technical support and smooth conduction throughout all 6 days. So without you all guys, it won't be possible. So thank you so much, ma'am, and your team. A heartful thanks to all our esteemed speakers of various institutes who's taking time for their curriculum, and they come here for sharing their knowledge and expertise throughout the 6 days. So thank you so much for all the speakers, and also thank you so much for all the moderators who moderating all the sessions are very well. Most importantly, sincere appreciation to all the participants for your dedication, active participation, and commitment throughout all 6 days for this webinar series more successful. Lastly, but not least, the heartful appreciation to entire organizing the IPWC Kheda team, my all the colleagues, starting with my district coordinator, Dr. Heta Patel ma'am, Dr. Shipra Shah ma'am, Dr. Grishma ma'am, and myself, Dr. Krishna Vyas. Our team work and dedication make these things possible. So, Team Kheda, we rock it. And as our Kheda district coordinator always says, the gratitude turns learning into growth and efforts into excellence. So because of these things, this possible. So thank you for all being a part of this wonderful journey of learning and the research excellence. As you already know that the something is remaining, so we are not done yet. As promised by the organizing team, now it's your time to shine. So now it's quiz time. So I'm requesting Grishma ma'am to share the link in the group as well as in the webinar. So now it's the quiz is open for 15 minutes. So kindly complete it and submit it within the time given. And the special note is there, the form will be automatically closed after 15 minutes. So don't miss this opportunity, and those who fill with this form on timely manner, those only will receive the certificates after that. So don't ask for certificates after 15 minutes. So it's your time to shine. Please go ahead and fill up the forms.
Ma'am, shall we proceed with closing the webinar?
Yes, please. I am all done.
Okay.
Ma'am, if you want to share something and the last note as we are ending this successful research webinar, then we'll grateful you, ma'am.
So, this webinar is also a small journey. I think Heta will agree to me because it was just, we were just doing a casual chatting, and the idea of this webinar series came by. And we are really happy that this idea turned to be true. And we could do something, we could, do something better. And I'm sure in future also we'll keep on coming up with these kind of scientific and academic events which will help majority of our fellow physiotherapists and physiotherapy students. So once again, on behalf of IAP, CEC, and IAP Research Committee also, I would like to thank everybody who has registered, and after registering who has attended, because there were 668 registration, out of which only 64 I am seeing right now. So thank you so much for trusting us and attending this judiciously and keep motivating us. Thank you so much.
Thank you, ma'am, for your kind words. And as we are in concluding this session. So the quiz is not only the surprise for you all. So we are definitely going ahead with the next upcoming session. So I have shared the detail with you, right, in the group as well as in this. I'll share the flyer. So as much as possible, and you just take this opportunity to attend this. So definitely your research journey, as I mentioned, your research journey is not only started, but yeah, of course it's mattered to you and all your fellow colleagues. So definitely you go ahead with this program also. Hita ma'am, shall we conclude?
Yes, ma'am. Yes, ma'am. Thank you, Nehal ma'am, for the entire support. And we will be having in the next to next month, we'll be having one more surprise for all of you.
Thank you so much.
Thank you, ma'am.